Guys, welcome back to another video on the channel, and in this video I'm going to be talking about this whole monkeypox situation and everything like that. As far as upcoming content goes, I'm not really sure what I'm going to be doing next, but stay tuned and subscribe if you haven't so you know when my next video is going to be coming out. I'm trying to build this channel. Otherwise, getting onto this whole situation, if you don't know about the monkeypox situation, basically, I believe sometime during the summer, maybe last month in June, I think it was like late June when this started becoming prevalent, these cases of the monkeypox were being heard, and monkeypox has actually been a thing for many years now, but it really was only in Africa, and there was not very many cases for that reason, but now it's starting to spread to different regions, and the World Health Organization director the other day declared this a public health emergency of international concern. So I'm going to be talking about this whole situation. I'm going to be reading off this article and then kind of breaking it down as we go along. So this is from the World Health Organization today on July 27th. It says, quote, "Good morning, good afternoon, and good evening. As you know, on Saturday I declared a public health emergency of international concern of the global monkeypox outbreak. More than 18,000 cases of monkeypox have now been reported to World Health Organization from 78 countries, with more than 70% of cases reported from the European region and 25% from the region of the Americas, unquote. So I'm going to stop there. I don't know why he's already declaring this a public health emergency when there's only 18,000 cases. Not only is there only 18,000 cases, but across 78 different countries, and most of them are in the European region as well. So this isn't I'm not saying this can't spread any further or that the cases are not going to continue to grow, because they're likely going to grow, but it's probably not going to be a super rapid surge of cases like we had with COVID in its prime. And 18,000 cases in total is really not a lot, especially across 78 countries. I remember when COVID was in its prime, like when it was at its peak, I was having like over 18,000 cases in my county alone. And to put that in perspective, my county has about 85,000 people, and we were getting 18,000 cases daily. So if you think 18,000 cases is a lot in total for the monkeypox, I mean, you're just straight up wrong. So I don't know why they're already declaring this public health emergency. I'll get more onto how this is transmitted later, and you're just gonna be even more dumbfounded by how the media has been covering this, especially with how this is transmitted. So continuing, it says, quote, "So far 5 deaths have been reported, a whopping 5 deaths, and about 10% of cases are admitted to a hospital to manage the pain caused by the disease. This is an outbreak that can be stopped if countries, communities, and individuals inform themselves, take the risks seriously, and take the steps needed to stop transmission and protect vulnerable groups." Oh, this is about to get good. "The best way to do this is to reduce the risk of exposure. That means making safe choices for yourself and others. For men who have sex with men, this includes, for the moment, reducing your number of sexual partners, reconsidering sex with new partners, and exchanging contact details with any new partners to enable follow-up if needed. The focus of all countries must be engaging and empowering communities of men who have sex with men to reduce the risk of infection and onward transmission, to provide care for those infected, and to safeguard human rights and dignity." So there is literally what he declares a health emergency, and he's still saying, well, we still got to protect human rights. We still got to let men have sex with men. It's totally fine. Even if that means that's the majority of that's the majority of how this disease is transmitted. Still, protect your human rights. Let men just keep having sex with men, but just try to be more careful about it. This is just so silly. It just shows you that even in the time of what he declares, this isn't an actual public health emergency unless you're, a gay man who's constantly having sex with other men. This is not a public health emergency. Well, he declares it as a public health emergency, but he's still worried about being politically correct by saying, well, we still want to safeguard human rights, but try to be more careful about it. It's so absolutely silly. Continuing, it says, quote, "Stigma and discrimination can be as dangerous as any virus and can fuel the outbreak. As we have seen with COVID-19, misinformation and disinformation can spread rapidly online. So we call on social media platforms, tech companies, and news organizations to work with us to prevent and counter harmful information." All right, stop there. So now he's going onto the trail of, if any misinformation or disinformation goes out there, just censor those people who are trying to debunk this idea, which means me, which literally means me, because I am going against what this guy's narrative is, and I am saying that I really don't think this is a public health emergency, at least so far. And it seems like the main way that this is being transmitted is not through, airborne particles, not through, just shaking someone's hand. This is like a sexually transmitted disease. And it's a very specific sexually transmitted disease. This isn't like HIV or AIDS or anything like that. This is men having sex with men. Just absolutely incredible stuff here. So, continuing, quote, "Although 98% of cases so far are among men who have sex with men, anyone exposed can get monkeypox, which is why the World Health Organization recommends that countries take action to reduce the risk of transmission to other vulnerable groups, including children, pregnant women, and those who are immunosuppressed." So he even admits that 98% of the cases are men who have sex with men, but he's still saying that other groups should still be on the lookout. And I wonder why that. I wonder what that other 2% is from. It's probably from kids who have gay parents and are exposed to this disease because of that. So just really, really bad stuff here. I don't know what to say. This is honestly just amazing what the media will do to continue to push their narrative, and at the same time declare this as a public health emergency, but then you want to say that we still need to protect human rights, even though that's the main way that this disease is being transmitted. Just makes absolutely no sense to me. I think that's as far as I need to go. I wanted to at least get to that part where he admits that it's 98% of the cases are among men who have sex with men. I wanted to get as far as that, but that basically sums up the whole situation there. And as you can tell, just the media coverage on this is just absolutely incredible. Declaring this as a public health emergency, but then you want to still protect human rights, even though that's 98% of the transmission. It's very, very clear that this disease is a sexually transmitted disease under specific scenarios. And I definitely don't be scared of this right now. Wait a little longer, and I'm pretty sure you'll see that it's really not as bad as they're trying to put it. So I think that's pretty much it, all I wanted to talk about in this video. Other than that, what do you guys think? Tell me in the comment section down below. Stay tuned for any future content and subscribe if you have not. That way you know when that future content is coming out. Other than that, like and subscribe, guys, and I'll see you next time.